Hello and welcome to my channel. If you are a LPN, LVN, RN, or NP, and you're looking to work remotely, you've come to the right place. Hi, my name is Jazzy RN. I've worked remotely for over 9 years in utilization review, and the goal of my channel is to help nurses pivot from the bedside to remote work. This first company is Sutter Health. They are hiring a clinical documentation specialist clinician. This job is full-time. Now, I always go straight to the requirements, and even if you don't meet every single requirement, and I'm mentioning every single preferred requirement, I still suggest you apply. Now, you must be an RN or a foreign trained physician. They want you to have a RN license in California or be a foreign trained physician, CCDS or CDIP certification, and 5 years recent relevant experience. The next job is a mental health advice nurse. This job is per diem, casual. You must be a resident of the following states. That includes Utah, Idaho, Arizona, Montana, Tennessee, Missouri, South Carolina, and Louisiana. You must have a California RN license or able to acquire prior to starting. RN license in the state of residence, 1 year mental health experience. This is preferred experience, and 2 years of practical nursing in a hospital, clinic, urgent care, or ER department. The next job is a clinical triage nurse, work from home. This job is also full time. There are two disclaimers. The first one is you must live in either Utah, Idaho, Arizona, Arkansas, Louisiana, Tennessee, Missouri, Montana, or South Carolina. The second disclaimer is this is a work from home position and your internet speeds must be at least 25 megabits per second download and 5 megabits per second upload is required. And you must have graduated from an accredited school of nursing. They want you to have an RN license for the state of California, and you can submit application without a California RN license, but you must acquire it prior to your start date if selected, and you must have an RN license in state of residence. The preferred experience includes 2 years experience in practical nursing in a hospital, clinical, urgent care, or ER department, and 2 years experience with several specialties and subspecialties. OB/GYN experience is preferred. Quick public service announcement. If you go to the description box below and look for the link that says resume tips, it will bring you here. And just a FYI, these are navigation links at the top of the screen. It will take you to my Udemy course I created. Office Essentials is a different website. FAQs is a different website regarding questions and answers working remotely. Where we are now is resume tips and interview questions. So when you scroll down, I'm going to explain this to you. Resume tips on the left-hand side, I highly recommend that you add platforms to your resume. That includes Epic, Microsoft Office, Cerner, Protouch, etc. Whatever software you currently use at your current job and previous jobs, you want to add that to your resume to make your resume more tech savvy. Also write your resume with this in mind: what you did, why it's important, and how it relates to the job that you want. Whatever information you have in your current resume regarding, let's say, giving medications or wound care dressing, you don't want to have that on your resume whenever you're applying to a remote nurse job. You want to focus on what you can do at the bedside that can also be done remotely, such as your tech skills or your critical thinking skills, communication skills, so on and so forth. And the job description will give you a blueprint of what you need to have on your resume to make your resume more marketable. And here's an example at the very bottom right here. I will give you more examples below. On the right-hand side is a template of how your resume should look. You only need one column, and I do suggest you use a simple font such as Arial or Times New Roman. Make sure that you only have just your city and state and zip code. You don't need your entire address. Make sure your email address is professional. Make sure your current job is in present tense. Your previous jobs are in past tense. And I suggest to add platforms used for each job. This next part is a bedside nurse versus insurance nurse. Now I'm going to start over on the right-hand side, purple part where it says insurance nurse. Now they have the exact same diagnosis. A bedside nurse is a patient, insurance nurse is a member. So the insurance nurse, the member is admitted for bowel obstruction, and the insurance nurse uses interqual. There's two options, interqual and MCG criteria. For the insurance nurse to approve this member's inpatient stay, the member must have an imaging positive for a bowel obstruction, must be NPO, NG tube to suction, and continuous IV fluids. all that information is met, and the insurance nurse can approve this authorization, this inpatient stay. And just a FYI, I work utilization review, aka utilization management, aka clinical review. On the bedside, hospital side, on the left-hand side in red, all of the charting done by the hospital staff, such as the nurse, the CNA, the radiologist, the doctor, that all is important for the insurance nurse on the insurance side to approve the authorization. Next are additional examples of what you should put on your resume regarding what you did, why it's important, and how it relates to the job that you want. And make sure you also focus on the description of the job itself. That will give you a blueprint of what you need to have on your resume to make your resume stand out. And I have 2 slides for these examples. And then below that is an interview tip. Make sure you are mentally prepared to provide real world examples. You don't want to have just a great resume, you also have a great interview as well. Next is Interqual and MCG certification. Now, I am not being paid to promote Interqual or MCG certification. The companies I've worked for train me on both Interqual and MCG. But if you want to make your resume more marketable by having a certification on your resume, then that may be an option for you, but just get one certification. I do not suggest to get both. Next is job search tips. So whenever you're applying to these jobs online, I do suggest that if you are really interested in that company, or if the company has lots of job openings, to join the talent network. This way they will send you an email notification of jobs that fit your resume or the job description you entered into the system. And I will give you an example. So here's an example. I had set up a email notification from USA Jobs to get notifications of jobs that are outside the United States. So my dream job would be to not work and win the lottery and retire. But my second dream job would be to get a job outside the United States, live outside of the United States. So here it is, USA Jobs sent me a notification on May 14th at 2:11 a.m. It gives up Department of the Army, the agency, hiring organization, so on and so forth. There's only one vacancy. It's in Italy. The salary from 76 to 99,000 per year. The open period May 13th to Thursday, May 21st, and it is permanent, but full time and open to the public. Now, as you can see here, this is a lot of information that is given. Most likely, the private sector will not have all this information provided. Some of the companies that you apply to, let's say you apply maybe 3 days after the job is posted, and the job you receive an email or after applying that they give you the rejection email. And just FYI, that sometimes happens because some companies have it to where they only accept so many applications, and then once the threshold is met, then any additional applications received get a automatic rejection. Just a FYI, make sure that whenever you see a job that you apply right then and there. Don't wait and don't hesitate. This next part is resume folders. So let's say if you are applying to different types of jobs, case management is also known as care management. Utilization review is also called utilization management, or clinical review is also appeals, clinical documentation specialist, so on and so forth. I suggest to have a separate folder for each type of job. That way, whenever you're applying to these jobs, that you're pulling the resume for the correct corresponding job. And last but not least is referrals. Now, referrals get your resume seen. And what I mean by that is it's not enough to just have someone on the inside give you the okay to say, hey, you can use my email address, my work email address, or my name as a referral. You want to send that person who's on the inside a copy of your resume. And that way, whenever you apply to a job that you are interested in, you let that person know that, hey, I applied to this position. Could you please forward my resume to the hiring manager or the HR person? That way your resume will get seen. The University of Maryland Medical System is hiring a senior clinical nurse to care delivery. This job is full-time. The hourly rate starts at $42.24 and goes up to $60.71. You must have an active RN license in Maryland or a compact state. A BSN is preferred or required based on organizational standards. Recent clinical experience in cardiology, heart failure, case management, transitional care, population health, telehealth, or acute care strongly preferred. Strong critical thinking and clinical assessment skills. Demonstrated ability to work independently while collaborating effectively within an interdisciplinary team. Excellent communication, patient engagement, and motivational interviewing skills. Comfortable using telehealth technology, electronic health records, and virtual communication platforms. Passion for innovation, patient advocacy, and improving outcomes in complex chronic disease populations. And I just want to add a disclaimer of my own regarding the telehealth technology and electronic health records. Make sure you add platforms to your resume. That includes, of course, Microsoft Office, if you know Cerner, Meditech, Protouch, etc. Whatever software or platforms you work on in your current job and your previous jobs, add that to your resume to make your resume more tech savvy. CVS is hiring a Minute Clinic virtual care nurse practitioner. This job is full time. This is an overnight position from 9:30 p.m. to 6 a.m. It includes every other weekend rotation. Qualified candidates must be licensed in Arizona, California, or Illinois and willing to obtain additional state licensure. You must have at least 2 years medically relevant experience or equivalent, effective verbal, written, and electronic communication skills, outstanding organizational skills, and the ability to multitask, initiative, problem solving ability, adaptability, and flexibility. Ability to work without direct supervision and practice autonomously, is proficient with information management and technology, capacity to collaborate with professional colleagues as necessary, to provide quality care, and depending on the market, the ability to be proficient in both speaking and writing in additional languages, but not limited to two, but including Spanish may be required, and a BLS certification. The next job is a care manager RN, and this job is full time. You must have an unrestricted RN license in the state of Ohio or a compact licensure in the state of residence, proficient in Microsoft Office Suite, including Word, Excel, Outlook, OneNote, and Teams, with the ability to effectively utilize these tools within the context of the CMRN role, access to a private dedicated space to conduct work effectively to meet the requirements of the position, confidence working at home, independent thinker, using tools to collaborate and connect with teams virtually, at least 3 years nursing experience, and at least 2 years of case management, discharge planning, and our home health care coordination experience. Coral Health is hiring a CDI specialist, RN BSN, and this job is full time. You must have experience with telecommuting, working with EMRs, electronic medical records, and other electronic tools, strong analytical skills, strong Microsoft Office skills, works well with numbers, strong team player, ability to work with multiple and diverse clients and projects, ability to work with minimal supervision, ability to maintain and access multiple files, assure that work product is completed with high levels of accuracy and attention to detail. They also require a CCDS or CDIP certification required, or be willing to get a CCDS certification within 6 months of employment, current RN license, 3 years CDI experience, and 2 years or more of clinical experience in an acute care setting is preferred. Panera Bread, you heard it right, Panera Bread. They are hiring a telephonic nurse case management manager. This job is full time. You must have an active, unrestricted RN license in good standing. Also, a nurse licensure compact, multi-state license is required. Must reside in the NLC compact state and hold a current multi-state license, which provides practice authority in all 43 plus compact jurisdictions. Single state licenses for non-compact states where the company operates are preferred. The company will support the cost of obtaining and maintaining required state licenses and must maintain all required licenses in active unencumbered status throughout employment. Also, the certifications include a certified case manager required, certified occupational health nurse, certified disability management specialist, and our certified rehabilitation RN preferred. St. Joseph Health System is hiring an RN utilization review. This job is full time. The shift is rotating shift. Just a disclaimer, this job is remote, but you will need to have on-site training in Mishawaka, Indiana. You must be an RN with a BSN preferred, active RN license, state-specific requirement applies, at least 2 years of acute care nursing experience, prior utilization review, case management, or payer review experience preferred, strong knowledge of Medicare, Medicaid, and commercial insurance guidelines, solid understanding of clinical care practices, diagnoses, treatment modalities, and hospital operations, excellent communication skills with an ability to collaborate effectively across teams, strong analytical and critical thinking skills to assess clinical appropriateness and compliance, proficiency in computer systems and Microsoft Office applications, ability to manage multiple priorities in a fast paced healthcare environment, and the flexibility to adapt to changing schedules, workflows, and departmental needs. HealthMap is hiring an RN case manager, 100% remote in New Jersey. You must have an active, unrestricted RN license. This is required. They also require a bachelor's degree, CCM preferred, 3 years of experience in case management preferred, experience in dialysis center or transplant center preferred, and experience with Medicare and Medicaid is preferred. Teladoc is hiring a senior clinical manager in patient care. This job is full-time and you have until June 5th to apply. A bachelor's degree is required, active RN license with 5 years experience, inpatient clinical and operational expert, telehealth experience, knowledge of healthcare systems and relevant workflows, experience with market analysis, business analytics, and financial modeling, and strong verbal and written communication skills. Anizio is hiring a virtual clinical educator. This job is full-time. You must have a current U.S. healthcare professional license. This is for RNs and RTs, associate degree, bachelor's degree, BSN or equivalent work-related experience, preferred at least 2 years experience working respiratory disease state or related field, a highly motivated self-starter with a desire to update professional knowledge base regularly, competency with call center telephone technology preferred, demonstrated effective and professional communication, excellent interpersonal skills with pleasant telephone manner and articulate phone voice, demonstrable organizational skills and ability to manage multiple tasks, ability to multitask while maintaining high attention to the detail and accuracy, process excellent and an ability to problem solve and be proactive, strong working knowledge of Microsoft Office, client-specific applications and database systems, and the ability to join frequent meetings and calls without disruption or disconnecting. Hartford Healthcare is hiring a clinical documentation specialist 1, HIM clinical documentation management. This job is full-time. Quick disclaimer, this job is remote. However, it does have monthly on-site responsibilities in the state of Connecticut. You must have an associate's degree or equivalent experience, at least an RN with at least 5 years recent clinical experience in acute care hospital, ICU, CCU, or strong med surg or equivalent. They prefer you to have an RN with 8+ years clinical experience in acute care hospital, ICU, CCU, or strong med surg, 2+ years experience as a CDS, and they do want you to have an RN license in the state of Connecticut.